The importance of federal funding for medical research. Hello, I'm Kelly Lynn, and this is Comcast Newsmakers. Joining me at this hour is David Moore. He is Senior Director of Government Relations for the Association of American Medical Colleges. Very nice to have you here.
Thank you.
Tell me a little bit about the Association of American Medical Colleges. Exactly what do you do?
We represent the 137 accredited U.S. medical schools and about 400 of the major teaching hospitals across the country. And the relationship to medical research is more than half of the federally funded research through the National Institutes of Health is conducted at our member medical schools and teaching hospitals.
Terrific. But one of the biggest problems that you face is that much of that funding is being reduced.
Yes, that's correct. Over the last 2 years, we've seen an actual decrease in the amount of funding for the NIH, or National Institutes of Health. What's even more troubling is, though, over the past decade, the NIH budget has failed to keep pace with biomedical inflation. So that means there are fewer grants and less progress against disease.
You have an interesting statistic to share, and it has to do with 80% of the research dollars for biomedical research. Tell me what the relationship is between those dollars and local communities.
Well, the National Institutes of Health really is a national effort. About 80% of the budget for NIH is awarded competitively to over 2,500 universities, medical schools, and other research institutions across the country. So these dollars have a direct benefit for communities in two ways. One is they improve the health of the communities because of the research findings, creating better treatments, better preventive strategies, but they also provide jobs for those communities. The academic medical centers where this research takes place generally are among the largest employers in their communities. And so we have both the health impact as well as the economic impact at the local level.
All right, and when funding goes down, it has an impact on certain diseases more than others. Tell me, with Parkinson's disease and diseases like that, what the impact can be when funding has continued to be reduced.
Well, Parkinson's is an excellent example. It's estimated that over 60,000 people are diagnosed each year in the United States with Parkinson's, yet we haven't had a new drug for Parkinson's in over 40 years. Now, Parkinson's is a neurodegenerative disease, and this is one of the most exciting areas of science. We're just really beginning to unlock the secrets of how the brain works, how nerve cells connect to one another. And so this is an area that's really ripe for opportunities for moving forward, making progress. But if we don't have the money to take advantage of those opportunities, the people with Parkinson's are going to suffer.
You say that there really is a breakdown in the understanding of how the funding works, even among our own congresspeople.
Yes, we hear from many people, why does the federal government have to support research? After all, institutions like Johns Hopkins and Duke have these massive research programs, but what they fail to understand is it's the taxpayer dollars coming through the NIH that are being awarded to places like Duke and Johns Hopkins. So it really is this partnership between the local universities and the federal government.
All right, so what can the public, people who are watching, families of those who have Parkinson's disease and other problems like that, what can they do?
Well, this is an election year, and we're having a national debate about priorities, what the nation's priorities are, and how the federal government can be involved in achieving those goals. And so I think it's incumbent upon all of us as potential patients, as providers of health care, as scientists, as business people, to get out there and talk about the benefits that NIH-funded research can provide to us as individuals, that can provide to our communities, and can provide to us as a nation. And so we're hoping that people will engage their policymakers in this election year and ask them about the importance of medical research.
All right, and how does a lack of medical research dollars affect maybe majors and things like that on college campuses?
Well, it certainly is a powerful disincentive to a young person considering a career in research if they see their mentors struggling to get funding. And so this is one of our biggest concerns, is that if this trend continues, we may lose the next generation of young scientists.
All right, David Moore, thank you very much for coming in.
My pleasure.
And we thank you for watching Comcast Newsmakers. If you'd like more information about events happening in your community, go to Comcast On Demand and click Get Local. I'm Kelly Lynn. Take care.